How can I manage joint pain with rheumatoid arthritis? What is the most successful treatment for rheumatoid arthritis? What should be avoided if you have rheumatoid arthritis? In this video, I'm going to answer some of the common questions I'm asked during a consultation for joint pain caused by rheumatoid arthritis, and then talk through what to expect with steroid injection therapy, which is a common treatment for rheumatoid arthritis. I'm Jeremy McNally, specialist rheumatologist at Circle Reading Hospital, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. If you've been diagnosed with rheumatoid arthritis, otherwise known as RA, you're no doubt well aware of the symptoms, including joint pain, stiffness and swelling in your hands, your wrists and feet and knees. Rheumatoid arthritis causes other challenging symptoms too, like fatigue and tiredness. Stiffness in your joints is more likely in the morning and after sitting for a long time. Sometimes pain can subside and then flare up again for seemingly no reason. If you don't yet have a diagnosis of rheumatoid arthritis, then I would typically run some blood tests and do an X-ray or MRI scan of your affected joints to look for signs of rheumatoid. Early diagnosis is really important, as this allows us to get you on the right medication, which will lower inflammation and work to prevent damage to your joints. When thinking about the most successful treatment options for rheumatoid arthritis, it helps to firstly understand what is causing the pain in your joints. With rheumatoid arthritis, you have an overactive immune system, which means your immune system is attacking your joints. This causes swelling, which stretches the joint capsule, resulting in pain and stiffness. If it's untreated, it can lead to permanent joint damage. If that's progressive and the joints are severely damaged, then unfortunately joint replacement surgery can sometimes be required. So this is a knee joint, which is very similar to the small joints that are affected by rheumatoid arthritis in your hands and feet. And what happens is that the immune system causes the synovium within the joint to overgrow. And this process will cause the synovium to invade into the cartilage in the joint and also into the bone and permanently damage these structures. So the cartilage is the blue structure and obviously the bone is this white structure. We have medication now which will switch this process off and prevent damage and get rid of inflammation from all of these joints. The good news is that if rheumatoid arthritis is identified early and you're put on the right medication, then the condition can go into remission, which more simply means the condition will be controlled. Alongside medication, physical therapy can be helpful, but the most important thing is finding the right medication for you to switch off the disease process. When I see patients, they'll have a consultation with me. I'll take a history, I'll examine your joints and take blood tests and sometimes scans on the same day. I may start you on some treatment straight away, which will usually get rid of some of the inflammation on the same day. That's either an injection, which sometimes works really rapidly, or some tablets. And then you would come back in a week or two to make sure you're tolerating the tablets and to assess what effect they've had on you. Common medications prescribed for rheumatoid arthritis are called disease-modifying anti-rheumatic drugs, or DMARDs. And these drugs can be used to slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Most patients can expect a good response to medical treatment, and only a small percentage of patients are in a situation where the inflammation cannot be controlled. We can treat most people with these synthetic disease-modifying drugs. It's worth knowing that this group of drugs are slow-acting and can take several weeks to work. So it's important to keep taking them even if they don't seem to have any effect at first. If you don't respond well to one of these drugs, or if you develop any side effects, then we may need to explore other options. In addition to drug treatments, steroid injections are sometimes used for particularly problematic joints, so it's worth knowing what to expect if you choose this form of treatment. Also known as injection therapy, this is a common and effective way of quickly managing pain and swelling in your joints caused by arthritis. Methylprednisolone is the steroid medication used, and it works by calming down your body's immune response to reduce distressing symptoms such as pain, itching, swelling and inflammation. Steroid injections are injected directly into your painful joints and take anywhere from 24 hours to 7 days to work. They usually last around 8 to 12 weeks, and if they're working for you, it's good to book and plan your visit in advance. Between treatments and physiotherapy, your consultant will advise you on all of your lifestyle factors that may play a role in your rheumatoid arthritis symptoms. Disturbed sleep and stress both can cause a flare-up of arthritis and should be avoided or managed if possible. Symptoms can flare up in different ways with different people, so your consultant would work closely with you to learn and manage specifically for you. Contrary to popular belief, there's no evidence that food or changes to your diet has any particular impact on rheumatoid arthritis at the moment. However, this is an area for intense research. So that was a brief answer to some of the commonly asked questions related to rheumatoid arthritis, diagnosis, and common treatments. If you're looking for more information on different types of arthritis, we have more videos on our channel. If you want to come and see me for a consultation, for specialist advice, or to talk through any treatments covered in this video, you can book online via the link in the description below, or search for your nearest local Circle Health Group hospital and the next available consultant in your area on circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, or want us to make more videos on this or other conditions, please comment below this video, as we'd love to hear from you. Otherwise, thanks for watching.